Welcome back, everyone. My name is Heather Mackey, and I'm the Senior Director of Cancer Prevention and Early Detection at the Prevent Cancer Foundation. Thank you for being part of this year's dialogue. Over the next 15 minutes, we will be hearing from the moderators of our breakout sessions. Each moderator will have a few minutes to quickly share some of their group's key takeaways and discussion points. While we know that this isn't enough time to share all that was discussed, we hope that this will provide some food for thought for all attendees moving forward. We will start with the moderators from our session on blood-based colorectal cancer screening, Molly Black and Caitlin Sylvester. Molly, would you mind leading off and sharing with us a little bit about what the key takeaways for your discussion were?
Absolutely. We had a wonderful discussion, and really honed in on the fact that we're excited. We're getting to this point that we'll have a test, but we're not quite there yet with a test that is the level of some of our other colorectal cancer screening modalities. But still the best test is the one that gets done. And we talked a lot about that, but sharing information with both the clinician audience and the patient audience to make an informed decision around which test is going to be the one that gets completed by the patient, which test is, what is next after that test. Some really great insights into one of our participants who works with tribal communities in educating that, if just because you have a positive fit doesn't mean it's going to be cancer. Yet with the blood-based test, that is what it means, and just kind of wrapping our hands and heads around that. But some really exciting opportunities to learn from research, to when the time's right and everything's approved, that we can apply through implementation science and get this option into the hands of particular unscreened communities.
Thank you. Sounds good. Thank you. Caitlin.
Yeah. Hi, everyone. So we had a really great conversation around opportunities, and then some concerns about, potential barriers and, disparities. So one thing we talked about is that patients may not necessarily see blood test screening themselves, but they tend to know that, maybe there's something coming. We also acknowledge that there could be a cultural shift. These sorts of things take time. There's unknowns, and right now we don't know what we don't know. Kind of like Molly said, it is exciting that there's the opportunity that this could be, part of the best test is the one that gets done. But we still know there's, colonoscopy is a gold standard is still kind of a phrase that's often used. We're encouraged by Kaiser's interviews with healthcare providers in the post-study that see it as a very simple approach, and there's a potential for it to become the standard of care, and that's really exciting. As far as barriers and disparities, it's challenging for clinical staff to track every piece associated with the FIT test. So there could be major barriers with blood-based screening that, separated from that. We did note that the study was done in a, urban setting. So what does this mean for rural communities where, mailings, in some rural communities, mailing is a better approach, where in others it's more a difficulty, like we heard from some folks in Alaska. Will this be a test for those that refuse, or will it become the new standard of care? Who's the right person for this test? And then what is the availability? Will there be the perception that only a certain type of person is recommended this test versus it being available in a high standard for everyone? And as far as tracking, so moving from a 1-year FIT model to a 3-year blood-based model, making sure providers can keep track of their patients and know who needs to be screened.
Very good points. Very good points. Thank you both. Thank you both. Next, we'll hear from our presenters on HPV self-sampling. This is Ellen Starr and Jasmine Tiro. Welcome to you both. Ellen, would you mind getting us started with what some of your key takeaways were?
Sure, absolutely. We had a great conversation. One of the interesting things about our conversation was that we had representatives from both the US and some low and middle income countries. And there was a lot of commonality in our challenges, despite the fact that you would think there might not be. The patient satisfaction clearly rose to the top for both areas, both geographic areas. And to the surprise of some people, but really right up there, not a big concern at all from what I could tell from what people were talking about. One of the biggest challenges that people talked about was communication. And when I say communication, I mean it on every level. So the obvious ones being how to get a woman her results, get her, how about getting her to return a sample? So in the US, it's how do you get it mailed, the test kit mailed to a woman and then have her mail the test kit back. In Kenya, for example, it might be how to reach a woman with her results. They use lots of people will use SMS. I've heard of people who are actually able to get lab results directly from the lab via SMS to the woman in the field or in her community. So I think that one of the exciting things about communication challenges is that as we get further along in implementation, we're going to start to check those off of our list of as we solve those things. But until we solve those things, a lot of it has the potential to not be successful because women need to get their treatment if they're screening positive. Education is still just as essential as it is when you're trying to educate somebody about getting in for a pelvic exam. Making sure you do good education around how to insert a swab into your vagina is critical. Having the good tools to do that. Let's see. Women have, most people have found that women are the biggest champions of this whole process. Like women, who wants to have a speculum exam? Who wants to actually go in, and in particular in low and middle income countries, I can say from my own experience anyway, that getting permission from a husband, let alone being comfortable getting on an exam table, is really big barriers. And that's very different when it comes to, in the case of the US, having a sample kit sent to you in the mail and going into your own bathroom and collecting your own sample and then sending it back in the mail. It's much more private, it's much more acceptable. So I think that's the big ones. Those are the high points, I would say.
Those are great. Thank you. Jasmine.
Yes, hi. So like Ellen mentioned, we had representatives from both the US and low and middle income countries, which made for a very robust discussion. In terms of the US, one of the things that we highlighted was for the importance of advocacy to prevent delay in uptake of HPV self-sampling for our uninsured and our publicly insured populations who would need approval of the test coverage by CMS, the Center for Medicaid and Medicare Services, as well as for the National Breast and Cervical Cancer Early Detection Program, which covers a lot of tests and follow-up for those who are uninsured. We also highlighted the fact that as education and outreach, some of the most important are people who are engaged in care, but really do not prefer a pelvic-based exam. So discomfort, psychosocial factors, cultural beliefs, that we do our education and outreach to highlight why this might be the ideal test for them. For those in remote communities, rural and low and middle income countries, highlighting the resources to support, educate, and train community health workers who might be being used to offer this screening is really important. The other thing that we highlighted was the fact that FDA is in the process of receiving an application for in-clinic distribution of HPV self-sampling. And so thinking through kind of implementation of in-clinic distribution will be important, particularly if in terms of low resource settings, safety net settings, being able to integrate it and understand how they have to change their clinic workflows and protocols, as well as how they would then integrate it if they use standing orders and distribute it via pharmacies and labs, and then result that and then do all of the follow-up via their patient navigators, et cetera. All of that will be important. So a lot of opportunities to partner with faith-based organizations and other community organizations with those safety net clinics to further extend the reach of their and offering of those services will also be important. And I'll stop there.
Great. It's hard to stop. It's hard to start. Great
That it is.
conversation and great points. Thank you both very much.
Absolutely.
So next, moving up to Mike Capaldi and Jody Hoyos and Caitlin Kubler, who will share some key takeaways on their session on multi-cancer early detection testing.
Thanks so much, Heather and everyone. We had a robust dialogue in our breakout talking about multi-cancer early detection tests and the fact that these technologies are coming. In some cases, they are here. And so some of the feedback and discussion that we had was first around general awareness of these tests, and are they available? When will they be available? What's the cost? So a lot of questions associated with that. So some work to be done there. I would say as a facilitator, general curiosity, interest, and maybe even optimism around the concept of multi-cancer early detection, but still a lot of work needs to be done in terms of education. And so we talked about education in the forms of one-to-one education at an individual provider, patient level, but also what can be done at the community level when it comes to education, and then even broadly across the oncology advocacy community, the importance of this new type of screening and how it's positioned with the others that already exist. In addition to that, we talked about access from the ability to get a test, to have a test administered, and then also what happens when you get a result of that test and the care and the continuum that occurs after that. And I'll provide a balanced perspective. On one hand, there was optimism around overcoming some of the disparities in screening with technology like multi-cancer early detection, but also then the sobering fact that in some communities, the healthcare system might be at capacity. And so there was some sharing about if we find more cancers, does that compromise the system? So definitely some things that we would need to discuss there. And then lastly, we talked about, what's on the forefront from a reimbursement or a coverage standpoint. And in fact, I'll turn it over to Caitlin now, who's the expert in that area.
Sure. I mean, ideally, we need the science to make sure that it proves that these tests are safe and effective for the public, but we also need to change the policy. And we know that Medicare doesn't have the coverage authority to make a decision. So ultimately, we need them to be able to change that. And that is going to have to happen through the form of legislation that we know is moving through the House and the Senate right now.
Points. There's a lot of questions, a lot of excitement, but I think it's just that balance of, what's ahead and trying to make sure we're prepared and what we can do to take steps to make sure our patients and our communities are well prepared for it as well. Mm-hmm. Thank you both. Appreciate it. And finally, and I think we're having a little bit of tech issues, so I'm waiting to see, let me check. Gotta love tech issues on the live. Jimena Marquez-Dagan, who led our session on research, and I'm looking to see, because I don't think that she is quite back on as of yet. So hold just one moment. I've got some of her key takeaways that I'll start sharing. And then if Jimena is able to get on, then we will move over to her so she can talk more eloquently than I am at the moment. But in terms of their conversation, from this session, we had the opportunity to hear from 4 Prevent Cancer Foundation funded researchers on the application of digital health technologies and what they're doing in their research to try to improve the early detection and prevention of cancers. Some of the key takeaways, looking at it, a lot of these advancements are technology dependent. While we may be studying them in one particular field of cancer, they really can have a similar effect in other areas, and perhaps on screening, in terms of overall. Another area that could have a similar effect on screening, like smoke detectors once had on home fires. One of our researchers is doing a lot of work on radon and its risk associated with lung cancer. And how can we use mobile technology through applications on our phones to be able to heighten people's awareness of what they need to do, to be able to help get information to them, to know where they can go to get test kits and what they can do to utilize and test those. There's an app for everything. So why not for cancer prevention, screening, different types of testing and such? Many of those reminders, I know that many of us, as we get our primary care notifications about when we're due for various tests or when we're going to come in, what other kind of things can we build into our regular routine so that it makes it very common for us to be thinking about what we need to do regarding our cancer prevention and early detection. And Jimena is logging in as we speak. So when you're ready, Jimena, just let me know and we'll bring you up live. And then people's response to text messaging. We have some limitations related to HIPAA. Certainly HIPAA does a lot to protect ourselves and our clients, but can cause some challenges and such associated with it.
Yes, thank you, Heather. I apologies for being a little late. However, I just want to give a brief update. Our breakout session, leveraging digital health to improve cancer prevention and early detection, breakout session was very well received. We had some great research partners that are doing great work, and their focus in increasing cancer screenings and prostate and lung cancer, cervical cancer. And they showcased the various ways that they are working to be able to adapt those technologies in different community settings. And the key takeaway by one of the presenters is really we live in a life that we have a mobile application for everything that we do. And he is hopeful and that we will have a mobile app for all types of cancer screenings, easily available for different community settings, healthcare centers. Granted, like you said, there is that HIPAA restrictions that's the next hurdle to see where that opens up and how that can be applied to the mobile applications for people to have access.
Yeah. That sounds great.
Thank you.
Thank you, Jimena. And I told you she would say it much more eloquently than I did. So thank you very much, and no worries about tech issues.